So one of the biggest challenges that we're finding now with cancer is that public sector financing remains low. And the consequence is that people are having to pay out of pocket for cancer services. When that happens, people are more likely to present late, they're less likely to initiate their care, and ultimately less likely to complete it. And because of that, cancer mortality continues to increase in so many places. The second major challenge that we're seeing in country is the lack of workforce availability. So as the number of cancer cases increase, a lot of it is being driven just by population aging and demographic changes. But as the cancer burden increases, many governments are finding that the number of cancer patients per year is also increasing. So that would mean that the workforce needs to increase, the infrastructure, and workforce is significantly understrained. Cancer services require primary care providers, but also require specialists to provide some of the more intensive therapies done at hospitals like cancer centers. And it's the lack of the specialists that can decrease the quality, increase the strain on families, and make it more difficult to provide timely care. As we think about the workforce, part of cancer care is also recognizing that a lot of cancer care happens outside of hospitals, and we should also acknowledge what's happening with caregivers. A lot of family caregivers are strained by cancer diagnosis. In fact, some studies are showing most of them aren't able to maintain their work or return to work after a cancer diagnosis. So when we talk about what's needed for cancer, financing is an important consideration. Where's the money going to come from? Because as of now, most of it's coming from the patient pocket. The second aspect is who's going to provide care. And unless we prepare ourselves for the continued increase in the cancer burden, the consequence will be more delays and more people paying out of pocket, suffering without adequate cancer care.